In 2023, a very important paper had been published where scientists were just looking at patterns and they were looking for myocarditis. And in the process, they stumbled into something that I think was absolutely important to be looked at. But that signal seems as though it has largely been ignored. I covered this, I did a whole course on this, and the link is in the description, talking about what the potential implications of this study could be. Now, I've come to the conclusion that our responsibility in terms of clinical work is primarily patient advocacy. There has to be a caution because if we go too far away from scientific consensus, it can be perceived as just being challenging for the sake of challenging. However, I have a long history personally of identifying patterns very early on that were very significant. As said many times, I looked at autoimmune responses in terms of SARS-CoV-2, specifically the spike protein and ACE2, from as early as April 2020. So I've been trying to raise the alarm on things for a long time. And it takes years sometimes for these things to be recognized. When it comes to this particular study, which I'll take you a little bit through, I think that this is one of those signals that the scientific community has ignored, and critically, the clinical community has not pushed them to actually follow up and explain. And it really was done as usual by the Japanese, who don't seem to be afraid to do science. And all that happened, this was quite early on. They knew that patients develop myocarditis after vaccination. They recognized that it could be found on cardiac MRI scans. However, they were doing scans in any case on patients who were having PET scans. This is looking at the uptake of fluorodeoxyglucose. And they thought, well, why not? Why don't we look and see if there is anything relevant that we find for patients who were undergoing these scans completely unrelated to myocarditis? So, in effect, they were asking the question that I thought should have been asked very early on, is that when you hear that there is a higher risk of myocarditis, specifically with mRNA vaccines, you keep on hearing that it's rare. And it's rare for somebody to have severe myocarditis that can lead to death or long term injury. But that doesn't mean it's rare to have subclinical myocarditis because you don't know if you don't look for it. So, this is the kind of question that these researchers were going to ask. And it seems as though it was at a time when you can ask these kinds of questions and try and get some kind of logical answer. And as I said, if you are interested, there is this whole course here that I've put together, Vaccine-Induced Abnormal Heart Physiology. I did this maybe 2 years ago, and I went through all of the things: structure of the heart, energy use in the heart, PET scans, change of use in heart failure. Is myocarditis possible? Other reasons why you could have had these patterns. So this was an important, in my view, piece of research, just to make sure you understand the science around it. When you realize that in the context of heart function, this is the thing. When we look at heart function, the way how the heart works, there is something very, very important about how it uses energy. And I think that this is the most critical thing that will help you understand why this study was so important. And I'm going to show you a slide that was from the presentation here. So the heart has to keep going all the time. It continually beats, and so therefore it has to be very efficient in energy use. And so what happens with the heart is that, in effect, when it's beating, it primarily uses fatty acids for energy. Now, these produce more energy than carbohydrates or glucose. And there is a bit of an overlap, where it's only about 10%, 10 to 40%, 60 to 90% will be free fatty acids. So, meaning that if you are asleep and your blood sugars have gone down low, most likely the heart will primarily be using free fatty acids, maybe up to 90%. If you've just eaten and your glucose is higher, possibly you will have more use of carbohydrates. But the question that they had looked for, and the reason they had looked at this, was simply because they recognized that myocarditis, inflammation of the heart, would also be associated with increased uptake. And so when they did this study, they then went and saw something quite unusual. And this is what it looked like. The majority of patients, when they looked at the vaccinated versus unvaccinated cohorts, and this was quite remarkable at the time, this was done very early in the pandemic, as soon as they were rolling out vaccines. You can see here the brain. The brain uses a lot of glucose. And so the brain is always quite dark. And across the board in everyone, this is what happens. So that makes sense. When we go down into the chest and abdomen, you can see here that there are dark spots here with regards to the kidneys. Kidneys also use a lot of glucose. But when it comes to the heart, this is a 43-year-old male. This is normal. A little bit of uptake in the heart. This is an 80-year-old male. A little bit of uptake in the heart. What you notice in these cohorts is that they are unvaccinated at the time. So what they noticed was, and this was a visual scoring that they used, that this is a 38-year-old male who has been vaccinated. This is very different from this. Why is there so much glucose uptake in the heart? This was a 72-year-old male. Again, compared to the 80-year-old, this is what they were seeing. And it raised a question that is not very clear. And you can see more closely here. And this is primarily in the left ventricle for this 38-year-old who did not have myocarditis at the time. He was just in there for some other thing. They just happened to notice this in relation to the heart. So something was abnormal. And the point that I'm making is that this study was done in 2023. When I looked for a follow-up study, there was none. Now, what I think has happened is that people have looked at the paper and they have discounted it because they've said, well, this wasn't right, or that wasn't right. The cohorts weren't matched properly, or whatever. But there is no doubt that it is very clear when they compared the two cohorts, vaccinated and unvaccinated, that there was a signal that suggested that there was higher glucose uptake in the vaccinated cohort compared to the unvaccinated. And this is what it looks like. These on the left here were the unvaccinated. This is 0, you can't see anything, no change. 1, a little bit. 2, more significant. 3, bright. And you can see this is the unvaccinated cohort. When you look at the vaccinated cohort, look at the percentages that have significant uptake across the board. This was considered a significant result. Now, they can't tell you what the reason is, because the natural assumption is to say this is myocarditis, but I don't think that's necessarily the most important question. It indicates that for some reason, after vaccination, there is a change with the way how glucose and energy is managed in the heart. And that's significant because the heart is something that you don't really want to mess around with. So where people make the mistake is that they think that this is now just relevant for people who've got myocarditis. No, no, no. Here is the thing that you have to reflect on. And I suspect, I wouldn't be surprised in the future that we have some of the sports people, professional, elite sports people, complaining about this kind of thing, because just reflect on this. Imagine that this was tennis. If you are playing against Djokovic here, who is able to manage 5 sets at almost 40, and this was his uptake in the heart, meaning that it's primarily using free fatty acids, compared to a younger player who can't manage 5 sets because they then notice the difference in fatigue because their heart is not as efficient. Because you have to remember, glucose does not produce as much energy as free fatty acids. So no matter what you do, you will never be more efficient by using glucose. This is very significant. Here's another thing that I wanted to highlight, because one of the things that I've pointed out is that there's a very high pickup. I think it was almost 20% of patients had lymphadenopathy, where they had lymph nodes that were swollen post vaccination. And one of the things that was noticed, and again, they couldn't make sense of it, they've highlighted it here in both vaccinated cohorts, the increased uptake in the axillary nodes. Now, this may not necessarily be relevant, but it is the kind of question that you would want to be able to answer whether or not this may represent more of an inflammatory response, not necessarily myocarditis, but something that indicates that there is a change to the way how certain organs will use glucose. These are really important questions. And what has happened is that because these are inconvenient questions, they when you and I'll tell you why. So some people may still be thinking, well, it's not such a big deal. We haven't seen any significant problems. I'm going to show you something here as to why I'm absolutely sure this is not something to be ignored. As I said, I have then looked at 186 million data points, not personally, but I've got a system that is able to analyze it. And when I looked at this across the UK, I then see this signal with regards to acute myocarditis here rising significantly. We look at, if you want to go down, I'm going down on the left, heart failure rising. This is 2020 here, post-pandemic, continuing to rise. We said myocarditis, heart blocks rising. All of these things are related to the heart. And what this is suggesting is that there is something that is happening at a population level. This is not an individual thing. It doesn't mean that everybody who has this is going to have these points. And what you find very often is that if you are not even exerting yourself, you wouldn't notice the difference. But for the person who is trying to run a marathon or the elite athlete, they may notice that difference in terms of their capability when they put their heart under stress. If somebody then has pre-existing heart failure, where they already had mild heart failure, they may then see symptoms worsen. Or if they already had overt heart failure, they then start to struggle even more. That's how you would see this kind of presentation occurring. But as I said, when you look at this paper, and I'm going to show you here, this is it in Google Scholar. And so this paper here, assessment of myocardial FDG uptake in PET scan in asymptomatic SARS-CoV-2 vaccinated and non-vaccinated. This was 2023, published in Radiology. What I then look at is the number of citations. Only 38 citations since 2023. That means that generally the scientific community is not looking at this in any great detail. A study like this that is so unique, I think, should have hundreds, maybe even over 1,000 citations with people looking at it. And it means, therefore, the scientific community is not looking at this data, not publishing on it. What do we do? Do we just go on and say, well, we hope for the best? It's your problem. what are we to do? That's the reality. I oftentimes say to patients, your blood pressure is your responsibility. What I'll say to you now is your outcomes are going to be your responsibility. You better start asking questions. Don't just depend on me. I'm one voice. It's very easy for them to suppress my reach, which has been done quite easily, 90% down. So only a few people hear this kind of discussion. If you don't start asking questions and starting asking better questions for your own health and the health of your loved ones, nobody's going to come and save you in the future, as you have seen already with what has happened with the pandemic. Think of all the people who have been injured. Nobody cares. Nobody's defending them. Nobody is protecting them. This is going to be your problem. So the most important thing that you can do is remain educated. So I will encourage you to at least take a look at this course. It will give you insight into the relevant bits of information with regards to what is going on there. And this will help you to see how the heart works, what's going on, all these relevant things, and at least you can know how to therefore have this discussion. At the end of the day, what you have to do is be educated and be prepared. I've put the link in the description for the course, as well as the study. And if there are any scientific or medical people, maybe if you wrote a paper about this, that would increase the citations and increase the reach for a study like this to be seen. Maybe they looked and didn't like what they found and didn't publish it. That's also a possibility. I've given them the credit that they haven't looked. But one of the things I'm realizing is maybe they did look. And maybe that's why nothing else has been done from a research point of view, because the outcomes weren't what they were hoping for. So let's continue to do this work. Let's continue to ask questions. And that, believe me, is not just my responsibility, but definitely yours as well. Have a great evening.